Today, Blue Ivy and I are going to demonstrate how to perform CPR, a life-saving measure that can help you save your pet's life in the event that their heart stops beating. Outside of my work in animal behavior, I was also a veterinary nurse on and off for a little over 20 years. My favorite stints being in the emergency department and the operating room. I want to take a little bit of knowledge that I gathered while working in the emergency room to offer some information to you about how to resuscitate your pet in the event that their heart stops beating, essentially performing CPR, cardiopulmonary resuscitation. If you like this kind of video, please let me know. We put a lot of effort into them and we're trying very hard to bring things that are valuable to you that you can use at home to help you and your pet. So if you like it, please let me know by hitting the like button. You can hit the subscribe button and the bell to be notified when new videos like this come about. So let's talk a little bit about what CPR is and why we use it. Well, again, we said it's all about reviving your pet in the event that their heart stops beating. You obviously never want to perform CPR if your dog's heart is still beating or they're breathing. So we'll go over how to know if your dog's heart is beating or if they're still breathing or not. So next we're going to talk about some tools that you can use at home to practice CPR. That way it's automated in the event that you ever actually have to perform it. Let's go grab some tools and get started. Okay, so what tools do we need so that you can practice at home? Well, I've got a few. One is a live dog, but I want to say we are definitely not going to practice on a live dog. I'll let you know what Blue Ivy is for in just a moment. The other thing I have here are two stuffed animals, one for representation of a small animal. You could use this as a cat or small dog. This is Johnny Justice, one of the Michael Vick dogs. And then we have our friend Oscar over here, who's going to show us how to demonstrate on medium to large dogs. So having a couple of stuffed animals, a couple different sizes will help you. All right, so when do we use CPR? Well, as I mentioned in the beginning, you want to use this only when your dog's heart stops beating. And I'm going to show you how to know and find a pulse on your dog so you understand whether the heart has actually stopped beating or not. That's really, really important because you never ever want to perform CPR on an animal who still has a beating heart. You also don't want to perform or practice CPR on a live animal because you could seriously injure your pet. So it's very important that we're only doing this on an animal whose heart we know has stopped beating. Now you might say, well, Sarah, my animal's breath is there no more. There's no respiration happening. Even if your dog is not respiring, it's all about the heart. That's where we're going to start. Okay, so let's talk about how to check for a pulse. A pulse tells you whether your dog's heart is beating or not. So there are several places to check for a pulse, but I'm going to give you the easiest and fastest one to go for. One of the largest, not the largest, but one of the largest veins in the dog to check for a pulse is the femoral vein. So we're going to be not so ladylike, and Blue is going to demonstrate where the femoral vein is right here underneath of her leg. So the best way to find this pulse or to feel for it is to take these two fingers, or even your whole hand if it's a larger dog like Blue, and just shimmy it down here in between her little ham hock and lay it over. You should, between your fingers, be able to feel that pulse. Right now I can feel Blue Ivy's pulse nice and strong. She's hot and happy, and I can feel it beating very well. You can search around a little bit, but to give you an idea where my fingers are, it's flowing right here between this area of my fingers when I'm laid out like this. This is the area right here. Again, there's several other places to check, but this is going to be your best bet. The other thing you can do is simultaneously, while you're doing this, if you're not well practiced at it, is you can also have them in what's called lateral recumbency, which just means on their side, which is how we're going to practice CPR. Blue Ivy, dead dog, dead dog. Thank you. So at the same time you're feeling for that pulse at the femoral vein, you can also just hold onto their chest a little bit. Just lay over it. Because sometimes we question ourselves when our adrenaline is pumping as to whether we're feeling something or whether we're not. So just being able to feel, especially on the left side of the chest, while you're holding that, will give you kind of double confirmation that their heart is or is not actually beating. Now we're going to move on to how to actually perform CPR. Okay, so before we get into the details, I'm going to demonstrate a few different variations. The variations being if you have one person or two person available, and if it's a small dog or a large dog. All right, so first we're going to talk about positioning, what position the animal needs to be in order to perform CPR. So Blue Ivy here, she's laying down nice and comfortable. Blue Ivy, dead dog. Thank you. Show us dead dog. This is what's called lateral recumbency. All it means is they're laying on their side. So starting with one person CPR in a medium to large sized dog, which is most common, you want to have them in this nice laying down sideways position. Now it's really important that they're on a flat surface because your chest compressions, which I'm going to show you how to do, are not effective on a soft or a bouncy surface because there's not actually any compression happening. So make sure that if your dog or cat is on a bed or on a soft surface like their own dog bed, that you pull them off of that surface and either have them on a table or on a hard floor so that you can actually perform these effectively. That's really important. The other thing I want to mention about position is that this is lateral recumbency, and this is what you're going to be in most often, unless you have what we call like a square-chested dog or a barrel-chested dog, like an English bulldog. They're more positioned like humans because of the shape of their chest. You'll notice that the chest kind of caves in this way, and to push all the way down and get to the heart, this is the most effective way to reach the heart, by pushing in this direction. If my dog's chest were square or wide like this, like an English bulldog's would be, the closest that I could get to the heart would be from the front. So if you have an animal like an English bulldog with a big old square chest, you're going to do CPR on them like you would a human, which is known as dorsal recumbency, or dorsal being on their back. Again, a flat surface. But this way, if you have a barrel-chested dog, will give you the closest reach, the closest point to the heart. All right, and you're sneezing already. So we'll put Blue Ivy here, since she's not a big old barrel-chested dog, back into lateral recumbency, and now we'll quickly go over where to be. So, most effective position is typically on your knees above and over the animal so that you can get your arms lined up and locked. It's going to be important that you have a nice straight 90-degree angle happening from the ground up your arm, and that you're going to lock your elbows together. You're going to cup your hands. Doesn't matter if it's right over left or left over right, whichever is more comfortable for you. And we're going to try to position this as close to the heart as we can. You'll feel there's a indent here where her chest is, and this is called her this is actually right where her diaphragm is, where her lungs are. So her lungs kind of come down like this, and then up here is her sternum. So kind of in between, right up here behind the shoulder is where you're going to find the closest spot to the heart. So that's where I'm going to position my hands. Again, I'm going to straighten up into a nice 90-degree angle from my arm to the ground. So I'm straight over top of her, and I'm going to put my hands clasped together so that I'm straight up and down from her. And this is the position that you want to be in for the entire duration that you're performing CPR. Okay, Blue Ivy. We're going to talk a little bit about depth, how far down we want to go. Think of this chest as 100% from the ground all the way to the top. You're making this difficult. Hold still. So down here is 0%, up here is 100%. What we want to do is we want to, when we press down on this chest, get it 2/3 of the way down, because what we're trying to do is squeeze that heart with our compressions. So when I press down, and I'm not going to do it on her because again I don't want to hurt her, but I'm going to press down to where her chest goes 2/3 of the way down to the ground, and then I'm going to let go and come all the way back up. Now, the important part is that the recoil, meaning letting go of the chest, is just as important as the compression down, because that gives the blood and therefore the oxygen to her brain time to fill full back through the veins and the arteries. So coming back up is just as important as going back down for compression. All right, now, one-person CPR, we're only going to focus on compressions. You're not going to take the time to breathe for your dog because it's ineffective. So if you're by yourself, the best thing that you can do for your dog is rush them to the veterinary hospital immediately, because they have all sorts of other life-saving techniques aside from just CPR and chest compressions. It's a little bit more advanced. But if you're by yourself and you need to start CPR, if your dog has just recently drowned, that's an excellent time to start CPR. So that would be one time where I would say, wait to go to the vet, go ahead, start CPR, and then if you can get some help to help you get your dog there, then go after that. So you're going to want to start right away. And the duration, the amount of time that you're going to do this for, is about 2 minutes at a time. In between those 2 minutes, you're going to take a quick breath, but you're also going to check for a pulse. Remember we talked about how to find that pulse in the femoral vein? So we're going to check for a pulse in between each 2-minute duration of chest compressions. But you're going to go for a full 2 minutes at a time when compressing the chest. Now, how fast, how slow, does it matter? Absolutely it matters. If you go too fast, again with that oxygen flow through the blood, it's not going to be nearly as effective. So you want to average this out, because it's going to be very difficult to count and know the exact number when your adrenaline's pumping, to about 100 to 120 beats per minute. Now that's something very difficult to count out when you're in an emergency situation and you don't want to have to think. So there's a couple different ways to do that. You can grab your iPhone and you can practice what that rhythm feels like. One of the easiest ways to do it is actually to pick a song that is 100 to 120 beats per minute. One example, kind of a dark example, is Another One Bites the Dust, but that's 100 beats per minute, and if you go to that tune in your head, you can create a rhythm without even having to think about it, and you can continue those compressions at the exact rate that you need to be most effective. The other song that you can use, which is a little more popular for obvious reasons, is Staying Alive.
Staying alive, staying alive. Staying alive, staying alive.
You can't tell by the way I use my walk. I'm a woman's man, no time to talk. Words are loud, women warm, been kicked around since I was born. Well, it's alright, it's okay. You can look the other way.
Okay. That's the type of rhythm that you're looking for, and you want to keep that going for a good 2 solid minutes of compressions. Okay, so before we grab our toys and physically practice, I'm going to show you one more thing with Blue Ivy. And this is just for the case that you have 2 people performing CPR. Remember I said with 1 person you're only going to do chest compressions? That's the most effective way to try to work to get their heart beating again. But if you have 2 people, you can take advantage of that to be even more efficient by adding in breaths for the animal, but then also switching off. And the switching off is actually the most important part because a lot of research shows that after 2 minutes of time, your efficacy, no matter how strong or fit or good you are with your chest compressions, starts to decline. So having that person to switch off really improves your efficacy with your chest compressions. And then you can also throw in breathing. Now again, chest compressions is a better way to circulate oxygen than actually breathing because what's coming out of your mouth is not all oxygen. It's oxygen and carbon dioxide. But it does help to get that chest going if you have 2 people. So I'm going to show you how to do that. Blue Ivy, dead dog again. Yep, we're going to play dead a lot today. All right, so for breathing, this is different from human CPR. In human CPR, you stop when the breathing happens. During canine CPR and feline CPR, there is no stopping. So you're breathing for the animal as the chest compressions are actually continuing. So you have 1 person over here that's working on their chest compressions, and then we're going to breathe. Now, talking about how often to breathe, just like compression duration is important, so is breathing duration. You want to breathe for an animal about 6 times per minute. That really equates to about 1 breath per 6 seconds. So if your job is breathing, all you have to do is count to 6. And every time you hit the number 6, go ahead and give a breath, okay? So to give a dog a breath, she's panting, this might be difficult, but you're going to close their mouth because you don't want what goes in to actually come out. So you're going to close your mouth. Cup your hands over their nose like this and breathe in. Now I didn't do that to her because again I don't want to hurt her, but again just to show you, you're going to cup just like this, close their mouth over their nose, and your mouth is going to go directly over their nostrils. You're going to seal your mouth right around this area right here and breathe just like that out. Now larger dogs, you're going to breathe heavier. Think about her lung capacity being a little bit less than my lung capacity, so you really want to push some air through there. The way to know that if you're actually being effective is you'll be able to see the chest fall and rise as you breathe in for the animal. Now remember, you're going to do this once every 6 seconds roughly, and you're going to do it for a 2-minute duration. Once you're done breathing for that animal for 2 minutes, that's when you're going to switch with your partner so that you can keep CPR going as effectively as possible. You'll literally take 1 to 2 seconds to check for a pulse and see if anything's going on. Now comes the fun. We're going to practice. Now practice is super important because you want it to be automatic. You don't want to have to think about it when an emergency happens. You just want to do it automatically. So we're going to start with our medium to large size dog, Oscar here. And we're going to practice exactly what I just showed you with Blue Ivy. Blue Ivy's taking a little break, watching the ducks, enjoying the shade. And so we're going to practice on Oscar. This is a really good thing to do with your kids at home. Grab one of their stuffed animals and let's go ahead and put them in that lateral competency that we talked about before. Now, again, we're going to get in a nice 90-degree angle on a flat surface with our arms locked out and our hands cupped together right over the position of where that heart is. And we're going to start by practicing our compression and recoil so they get used to letting go. It's really important to let go and let the animal's chest fill back up. So we're going to press down about 2/3 of the way and let go all the way back up. 2/3 of the way down, all the way back up. I want you to do this over and over and over again so you get the feel of letting go right at the top so that you allow the chest to completely recoil. It's so important for that oxygen to be able to flow both directions, so you need to allow that to happen. So again, just down 2/3 of the way, all the way up. Down 2/3 of the way, all the way back up. Now, once we've had that practice for a bit, we'll go into straight compressions. We're going to pretend that I'm the only person here on the scene. My dog just got pulled out of a pool, or I pulled him out of the backyard pond, and I want to start chest compressions. So I'm going to get into my position, and we're actually going to practice this. 2/3 of the way down, 100 to 120 beats per minute. So I'm going to get my rhythm in my head, and we're going to go. Now, important to remember that you breathe as well, because you're going to run out of breath fast doing this, believe it or not. Notice that my compression is actually coming from my shoulders, not from my arms. I'm not moving my arms, I'm staying straight up and down. That's where your strength is. Okay, and that's really it. Now, there is a difference between doing CPR, as we mentioned before, on a medium to a large dog and a small dog. A little bit different of a technique. So even though Johnny Justice is bigger in real life, we've got a small one here to demonstrate with. So if I have an animal that's a puppy or a cat, a chihuahua, anything that's smaller, their chest is much tinier. So if I do compressions the same way on this animal, I'm gonna really hurt them. It's just too much pressure. So we do something called cupping. And all cupping is where you cup your two hands together like this. So large dog CPR like this, cupping, small dog CPR like this. What I'm gonna do is slide my hand under the animal and I'm gonna cup my hands together at their chest. I'm still gonna keep my arms straight. I still have a 90-degree angle. I'm still gonna go at the same rate. Now, small dogs' hearts and small cats' hearts beat faster. You're getting closer to that 120 beats per minute. Same principle applies, only difference is I'm just gonna squeeze my two hands together. Now, notice my hand goes down 2/3 of the way, all the way back up, just like it would if I were doing chest compressions on a large animal, 2/3 all the way back up. So cup underneath, close your hands together, compress. Same exact rate. Notice that my hand, I'll turn this way so you can see, when I go down for a compression, comes all the way back up each and every single time. Now, in this sort of CPR, instead of both shoulders being what is driving my arms down, it's really one shoulder, in a sense, driving it down. So that's really the only difference. If you have a much smaller chest size, you want to be aware of that because you're going to hurt the animal doing CPR the way that you would on a large animal or a human. So again, just a nice cupping motion, two hands together with the chest in between, and we're just pressing this meaty part of our palms together to squeeze that heart in between. Thanks so much for hanging with me through this video. There's a couple more important items that I want to go over just to tie everything together and make sure that I'm giving you the best information to be as efficient as possible with CPR. First things first, please remember to smash that like button if you value the content that I'm putting out there for you and you appreciate the information. Now, the first thing I want to mention is this is a broad overview of cardiopulmonary resuscitation. And what I mean by that is this is the bare basics. So there are a lot of moving parts and pieces in the veterinary hospital and the emergency department that the medical professionals put into practice to save the life of your pet. This is simply a broad overview again to give you the tools that you need at home in the event that something happens that you can respond immediately on site. With that being said, the best way to practice this and to know that you're being most effective with CPR at home is to actually do this in front of a medical professional. So look in your area and see if any of the veterinary hospitals or other medical professionals are offering a CPR class. It really helps to have somebody look at, evaluate, and help you through your technique so that it can be automatic in the event of an emergency rather, like we mentioned, than you having to actually think about anything. If you happen to be in the Charlotte, North Carolina area, I do offer group classes on CPR, but that's your best bet to know that what you're doing is the way that you can do it the best to help your pet. On to survivability and expectations briefly. She's getting a little hot, Nancy, here. It's boiling out here in the Carolinas. Survivability is really low, unfortunately, in the event that you ever need CPR. So I just want to set the precedence for you that in the human world, in the event that you need CPR, there's about a 20% survivability rate, meaning only about 20% of the people that actually need that make it to discharge out of the hospital. In the animal world, unfortunately, we're still only about at a 6% survivability rate. So even if you give it your best effort and you do everything the right way, chances of survival are very, very low in the event that they need CPR. Now, it does matter as to what happens to the animal, what caused the reason for their heart to stop beating, as to how likely survivability is as well. For example, an animal that you've just caught that drowned is more likely to survive than an animal you do CPR on that, say, had some traumatic event like being hit by a car in the middle of the road. The chances of saving the drowning dog are much higher potentially than saving the life of the dog that was hit by a car. But this is why efficiency is so super important. So Some of the numbers that we throw out there, like 2 minutes and 100 to 120 beats per minute, these are all things that you can think off the top of your head very quickly to be as effective as possible, given that the survivability rate is so low. But I just want to mention that so that you're not hard on yourself in the event that you ever have to perform CPR and it's not successful. Oftentimes it's not successful. Most of the time it's not successful in the hospital practice where they have all sorts of drugs and machinery and other items that they use to help save the life of your pet as well. Last thing that I want to mention is there are other ways to be prepared for an emergency also. So most of the time, your private practice veterinarian will see emergencies, but you should always ask them if they're prepared for emergencies first. Some veterinarians choose not to see emergencies, so it's important to know ahead of time if your veterinarian, during normal private practice business hours, is a good place to go for an emergency. If they say yes, go to your regular veterinarian that knows your dog's history in and out in the event of an emergency. If not, you want to know where the closest emergency room is. And you want to know where the closest ER is as well, because typically private practice veterinarians are not open all through the hours of the evening, whereas emergency rooms are 24 hours. So make sure you not only know the closest emergency hospital to you, but also the best route to get there in the event of an emergency. Because when it boils down to it, the best place for your pet to be in the event of an emergency is in the care of medical professionals. So thanks so very much for watching this video. I hope you found some value in it. I hope you practice CPR so that in the unlikely event, hopefully you never have to use it, you have that skill in your toolbox. Please comment below with any questions that you might have, and I'll do the best I can to answer them in the best way that I possibly can. Thanks so much again for watching.